Hey there, this is Nifemi Ayelomi and you're welcome to Cleft Care with Nifemi Ayelomi. It is Cleft Lip and Palate Awareness Season, so let's talk more about it. Cleft lip and palate is a congenital condition seen on a newborn. Cleft lip is an opening on the lip. Cleft palate is the opening on the roof of the mouth, which is also the palate. It can be complete, incomplete, it can be unilateral, that is one side, or bilateral, that is on the two sides. Cleft forms between the sixth to ninth week of pregnancy. Many times, the woman is not aware that she is pregnant. Hence, it might be unavoidable. This means anyone can have a child born with cleft lip and palate. Every woman of childbearing age is therefore advised to live healthy. Planned pregnancy is essential to ensure all needed supplements are taken. Abstinence from alcohol, smoking, stress, drug abuse, and exposure to radiation can reduce the chances of having a child born with cleft lip and palate. Also, taking a lot of water, folic acid, fruits, and exercises can also reduce the risk of having a child that is born with cleft lip and palate. Most of all, cleft lip and palate is not a disease. It is repairable, and the child with this condition can live a healthy life. Cleft lip and palate has attracted a lot of myths and beliefs, and this is due to the inadequate awareness of the condition. Here are few myths and beliefs about cleft lip and palate, and it is absolutely false. Some say the children are abomination, a reward of evil, the mother walked at midnight or at midday, a reincarnation, a result of fornication, a deity or god, the mother ate an abominable food, and so on. The awareness of cleft lip and palate should therefore be rooted in our villages and communities, educating the traditional attendants, midwives, and community rulers because they get to see these children even before they get exposed to their environment. Adequate information about it, possible causes will then reduce the rate of infanticide, stigma, and a possible depression due to the psychosocial embarrassment. The awareness of cleft lip and palate should also be very sound in the cities and heard on all social media platforms, media stations, articles, papers, should be taught in schools and even in worship places. Anyone can give birth to a child with cleft lip and or palate regardless of their social economic class. Cleft lip and palate is repairable, but the treatment options are not immediate. Hence, counseling and reassurance to both parents and caregiver is a major tool to a successful cleft treatment. The challenges that are common with the children born with cleft lip and palate are difficulty in feeding, speech difficulty, malnutrition due to the condition, social acceptance, stigma, discrimination, rejection, just to mention a few. Please note, feeding difficulty can be managed when the baby is seated at a 45 degrees, and also the use of a special feeding bottle is helpful for challenging women that cannot breastfeed directly into their children's mouth. A child born with cleft can breastfeed and have a balanced nutrition, which will help in their growth, organ development, and building immunity to ensure a successful treatment and surgery. Parents and caregivers need to be well counseled, reassured, and monitored to ensure their own mental well-being is stable. Parents are also encouraged to be patient in the care of the child, considering that treatment, especially surgery, is not immediate. Rendering assistance in every possible and involving the expertise of a social worker can be of great help. However, the orthodontist, pedodontist, nutritionist, speech therapist, social worker, nurses, and surgeons continuously contribute to the comprehensive care being given to the children. On this note, it is worthy to appreciate the immense contribution of Smile Train in providing trained and skilled professionals to give the adequate comprehensive care for the children born with cleft at no cost. Smile Train is a charity organization whose passion is to see that every child born with cleft lip and palate has adequate care and enabling them to be socially acceptable and psychologically stable to be fit into the society. Smile Train is changing the world one smile at a time. For more information on locating the nearest Smile Train partnering hospital, kindly reach out. Every of the treatment is absolutely free. No child born alive deserves to die of a repairable condition. Cleft lip and palate is repairable.